So today what we're doing is we are learning a technique called deep anterior lamellar keratoplasty, or DALK, D-A-L-K. And that is a technique for corneal transplantations. That involves trying to leave behind a thin layer of cornea. So you have to dissect the front of the cornea off the back and leave the back intact. So we're having some lectures followed by actual hands-on training. So Eversight provided us cornea and also other equipment to do this procedure.
The purpose here is really to give exposure to some of these techniques that some surgeons might not get a chance to practice in the OR. DALK can be an intimidating surgery to pick up. So the idea is you want to get some comfort level by working on low-stakes situations like working in the lab, working on human eyes with supervision, where you can get these techniques perfected before you take them into the OR on your actual patients.
So it's impossible to replicate hands-on learning. You can watch videos, watch lectures, but especially for things like this where you're having to feel what a real cornea feels like as you're dissecting it, there's no substitute for doing this with a real cornea.
I mean, our specialty is incredibly manual in terms of what we do. So everything that we practice outside the operating room itself is going to be that much more comfortable, and obviously we want to maximize safety for our patients while we're still trying to be innovative. It's hugely important. There's not a new technique that I ever would bring into the OR that I wouldn't try to practice to the best of my abilities in the lab first.
Eversight's been a great partner. They're responsive, they provide great tissue, they listen to concerns, they get back to me promptly, and then also their willingness to work with us on educational programs like this is really excellent.
There's such a huge partnership here. We depend on each other. We rely on the eye bank to provide us the highest quality tissue for our patients. The eye bank relies on us to basically have a demand for that tissue, and that connects us to the patients together. So having Eversight join in partnership with us, I think the ultimate response has been nothing but positive. We have a great relationship with all the Eversight personnel, incredibly good back and forth to troubleshoot problems in real time. Had a great relationship with them in getting things for our patients when we need them rapidly.